So I'm Sarah Harig. I am the Clinical Program Manager for Mental Health Services here at Family Service of Roanoke Valley.
And hi, I'm Megan Brookshier, and I am the Program Coordinator in Youth Development Services here at Family Service of Roanoke Valley.
Megan, so today we're going to talk about the impact of COVID and what that's meant for our staff here, what that's meant for the services that we provide, and really what that's meant for mental health around the world.
Yes.
So, some of the things that I've noticed in terms of just what's really stuck out to me, I was reading an article about, the impact that it's had on mental health. And one really staggering statistic that I saw was people have reported anywhere from 33 to 52% that COVID-19 pandemic has impacted their mental health.
Wow.
Which is a lot, but especially when we put it in contrast to before the pandemic, that reported number was only 13%.
Wow.
So it's really, really had an impact. And I think we're seeing that here at Family Service for sure. Not just in our wait list. We're seeing people who've never really struggled with mental health concerns finding that they need to seek out services. But also people who maybe have had struggles in the past are noticing that things that have worked before aren't working anymore, and they're also needing support. I know just in the clients that I see, I've seen, I work primarily with kids, a lot of anxiety, and I think some of that is from their own personal struggles, but also just from the family units that they're living in, the schools that they're part of, the other community programs that they're in, having an impact on them as well. Seeing that they're the adults that they trust to have it, not really having it all together, and the impact that that's had. So that's some of the stuff that I've noticed. I'm wondering kind of what you've noticed in terms of the impact on family service.
So what I've noticed is that it's definitely changed the way we engage and provide services with our clients. We've had to really increase our social media outreach. And that kind of looks like being brave and stepping outside the box to think creatively, to step outside of our comfort zones. It's not the most natural thing to provide services over a computer screen,
Right.
but we've had to get over that and do that, because what I have noticed is that the needs of our clients do not lessen, especially in this pandemic, they seem to increase. So I feel like more is required of us than ever before, as mental health factors such as depression and anxiety have been on the rise. And that really looks like incorporating our technology, increasing our social media outreach. So that's what I've noticed for the impact of COVID-19 here at Family Service.
I think I've noticed too a change in the way that we support one another as staff.
Yes.
I think to think that we're not impacted, even though we're the ones who are providing services, is to really miss a really important piece of what's going on with this pandemic. And so figuring out what to do when therapists and other helping professionals are in crisis too, and how do we make sure that we're maintaining our mental health so that we can be there fully for the client and community that we serve.
Whew, that is an excellent point. Yes.
And so we're having to get creative in that way too.
Yes. Very important to check in on each other. Oh.
Yeah. So you mentioned using a screen to provide services, and I know in the counseling department, one of the departments that I'm over, and our community counseling as well, we've had to start using telehealth, and so that means using a HIPAA compliant platform. That was something I had never done before this, and so really stretching my skills as a therapist, and stretching my staff skills. And learning new and innovative and creative ways to really engage with our clients over that platform. Although we found, a lot of clients really, really benefit from it. Clients that maybe I had been stuck with before the pandemic have made really great strides. That's not always the case. And so there have been some clients we've had to bring into the office, and so that's changed kind of the structure we have around sessions. So making sure we're doing things like cleaning and making sure that we're, putting all those precautions in place, like wearing a mask and socially distancing. And screening. So that's taken a lot of being more thoughtful around the services that we're providing, if they are in person, because they're clinically necessary. One really great program that we have down in counseling is our 4 free sessions. So anyone who's been impacted by COVID or just kind of the things that are going on in the world right now can call and say, I'm interested in services, and they're entitled to 4 free sessions, COVID sessions. And then during those sessions, we link them to services that are in the area, resources that they need, and really just kind of focusing on solutions to help them get through this really difficult time.
That's amazing.
Yeah. So, lots of changes down here, although I think everyone is really rising to the occasion, and I've been really inspired
Yes.
by staff here and just the changes that they're coping with and doing well with.
Yes, I have absolutely seen that with our youth development program as well.
Mm-hmm.
It is very inspiring the way our group facilitators have created this whole social media platform to still stay engaged with the youth that we serve.
Mm-hmm.
And not just with social media. So for our younger ones that we work with who maybe are too young to have their own social media accounts, over the summer we started a pen pal exchange program, which was super cute. So we actually did get some letters back, which was really great. And some of the kids just drew pictures. Some of them put in recipes that they had tried baking, books that they were reading. And then one kid definitely wrote back with jokes and riddles, which was super cute. So the pen pal program was really fun.
I love that.
Yes, it was so cute. In terms of social media, we really wanted to explore that because we still wanted our youth to have a safe place to come connect with us. So that looked like creating a youth we had it, but we really, we sent out invitations to kids that we could have access to on there. So our teen outreach program Facebook page, we did videos that had mindfulness tips. We did our teen outreach lesson videos that we put on there. Some of us, we read chapters from a book just as a way to still do something together and stay connected. We also, some other non-social media things, but we partnered with Roanoke City Public Schools over the summer to help with their meal deliveries. And that was just really nice to still have some type of socially distant seeing of our kids. It was so exciting when we would see some of them along the routes and just wave, and it did everyone's heart so good. And then we've worked really hard to reach out to our community partners to collaborate with them on how we can offer any services and support. Our neighborhood community centers that we partner with, they have all shifted to help out with becoming virtual learning pods. So we have been working with them just how we can provide assistance and support any way that we can, because that, the virtual learning, as many of you all out there know, is a huge undertaking. So that's how we've been able to just get creative in how we collaborate and help them out.
And I hear in everything that you're saying, just this underlying need for connection. And I think everybody, at Family Service has really worked on making sure that we're connecting not just with each other, but with clients in new and innovative ways, which has just been really exciting to be part of. And I think that's the one thing that I think when all of this is over, hopefully sooner rather than later,
Yes.
but I'm being patient, that I want to carry forward, is that intentionality around making sure that we're staying connected,
Yes.
And being involved in our clients' lives in ways that are helpful, and working all together, right?
Yes.
So with the community, which has been wonderful as well.
I agree.
So it's been an exciting time.
Yes. Challenging, but exciting.
Yeah.
So we hope that this has been informative for any of you watching. If any of you are struggling, please remember you can call our main phone number and get connected to the 4 free services for assistance. And just remember to hang in there and stay safe. And we're thinking of you. And
we're here for you.
Yep, we are here for you.
So please reach out. Don't hesitate.
Yes.